Hello, welcome tonight. Let's talk about penile fracture. A penile fracture may occur if you forcefully bend or hit your erect penis and damage some of the tissues. It typically occurs during sexual activities. You will hear a popping or cracking sound and immediately lose your erection and experience a lot of pain. Comes with a lot of pain. Most causes of penile fracture require surgery. What is a penile fracture? A penile fracture is not really a fracture because the penis is not really bony, as some people have thought. However, you can break your penis if you severely bent or hit it while you have an erection. A penile fracture is not really something that you can just treat most of the time at home because however you can break your penny if you severely bend or hit it while you are thrusting on the hard part on the female pelvis. And I want you to know that your penis contains tube-like erectile tissues, two that run the length of the top of your penis. They call it corpora cavernosa, and one that runs along the bottom of the penis. We call it corpus spongiosum, and which also surround the urethra. You can't see the urethra outside. And a strong fibrous connective tissue layer, we call it tunica albuginea, is the one that covers those tissues. So you can't see it outside. So when we're talking about penile fracture, it occurs when this tunica albuginea tears open. How serious is a penile fracture? Penile fracture is an emergency. You must get help immediately. How common is it? Penile fracture is very common, but though it's unclear how often penile fracture occurs, but some reports says it may occur in 1 in 10,000 to 1 in 100,000 people who have a penis. However, it may be more common but rarely reported because many people who experience a penile fracture don't recognize that it's a medical emergency and they avoid seeking treatment or are shy about talking about it. What are the symptoms and some of the causes? The symptoms of penile fracture include, like I said the other time, a popping or cracking sound like that. And immediately it happens, you have loss of erection because it must be at an erection before it can happen. Bruising and swelling from the buildup of blood under your skin, blood in your urine, we have hematuria, or at the tip of your penis. Pain while peeing, that's dysuria. What does a penile fracture feel like? A penile fracture usually causes immediate and serious pain, intense pain. And the pain is not something that might likely go away shortly, or it may last for a very long time. And at times, can a penile fracture go unnoticed? In most cases, if you fracture your penis, you will hear a poppy sound or a cracking sound. You understand? And when it happens like that, you might not be able to go unnoticed because there will be bruising, there will be pain, there are swelling. You will also have difficulty getting further erection. No more erection. And if it is not a penile fracture, you might have another type of soft tissue injury. So, what are some of the causes? Number one, it might be a blunt force to your erect penis, you know, like um like including maybe sexual intercourse with a partner, you understand. It often occurs when your penis slips out, maybe by mistake, out of your partner and you were trying to thrust in again, but instead you hit it or bend your penis against the pelvic bone of the or woman, or the perineum, that's the layer between the skin and the anus and the genitals. It can happen. Then if you do energetic masturbation, rigorous masturbation, or rough masturbation, can forcefully bend the erection. Unintentional trauma, this is a much less common depending on the amount of force to your erect penis. But it may include falling onto your erection, you understand, rolling onto it or eating it against a wall or a door in a dark room. You understand? And there's something we call takadan. This is a method of bending your erect penis in order to change its shape or to discourage masturbation by making an erection go away. And when we're talking about takadan, it's more common in the Middle East or Central Asia. Who does penile fracture affect? Penile fracture are more likely to occur in people 40 and under who are more sexually active. Can it be cured without surgery? A true penile fracture requires surgery to reduce your odds of having erection difficulties in the future. Right. So, because if you don't get it fixed with surgery, you might get permanent erectile dysfunction. If you don't have surgery to fix a fracture, and erectile dysfunction is when the penis cannot even sustain an erection or maintain it. If you injure your penis tissue but don't have a fracture, you should have a non-operative treatment. And when we're talking about non-operative treatment, it may include like ice pack. They may give you a fully catheterization. They may give you some drug we call non-steroidal anti-inflammatory drug to reduce that, like acetaminophen, Tylenol, and all that. Then what happens if a penile fracture goes unnoticed? It is not a good idea to try to let your penis heal a fracture without itself. Because without a treatment, a penile fracture may make it difficult or impossible for you to get or keep an erection long enough for sexual relationship. You may also experience penile curvature, you understand? And you are also at higher risk of developing other problems such as difficulty in peeing, scar tissue formation, which can limit your sexual we can limit your sexual activities. So take care of yourself. Take uh, another step to see your doctor if you know there is need for that. And see you in the next video.